Welcome. I'm Marsha Elizabeth Thompson, also known as Dr. M, and this is drm.com. I am a Chinese medicine psychologist, and I teach natural medicine practitioners, specifically Chinese medicine practitioners, how to treat developmental trauma within their scope of practice, utilizing the Eastern philosophical methods of Taoism, Hinduism, Buddhism, the primary Eastern philosophical approaches to psychology and the healing and resolution of the human mind in combination with contemporary psychotherapy techniques, EMDR, IFS, or internal family systems, and somatic experiencing polyvagal theory, the Feldenkrais method, the primary somatic therapies with which I work in my practice. Now, this presentation is going to last about 30 minutes, and it's designed to give you an understanding and an insight into what's available to you as a natural medicine practitioner for how you can work with developmental trauma in practice. Because as most of us know, the clinical counseling courses, or whatever they were called when you were pursuing your advanced studies, are insufficient to give us the tools and the skills and the presence of mind and the presence of self when in real time with a patient who's presenting with a whole host of physiological disorders. Complaints is my least favorite word to use when working with patients. The presentations that, while they may be difficult to treat and while they may be all over the map, all ultimately point to a history of a dysregulated nervous system, which is then producing all of these bells and whistles going off in the body and in the mind and in the life. So we're going to look at a method that I have devised that has brought me great success and satisfaction and fulfillment and peace of mind and even joy in the process of witnessing my patients move through and move from histories of developmental trauma to a life of freedom and clarity. So let's go straight to the slides and we'll get right into presentation. Oh, and in order to do that, I need to share my screen. So let me share my screen with you. There we go. There we are. So getting right into things. So the compassion cure is what I have called this approach, and it combines EMDR, IFS, as you can see here on the title slide, and somatic therapies. Now, what we're looking at when we're working with each of these methods, and I'll start speaking about them right after this sentence, is a combination of clinically proven, so there's evidence that these methods work to shift our relationship and to recode the brain, which is the case in EMDR, to rework the relationship between the mind, the body, and the spirit, which is where IFS comes in, and to reharmonize and reintegrate the fractured self into once again, a functioning whole human being. I'm calling it enduring recovery because this is not just a one-size-fits-all or a one-shot method of treatment when we are recovering from developmental trauma, because we are also reworking our karmic narrative, or if you prefer to look at things from the Western clinical perspective, we are transforming transgenerational traumas. We are reworking epigenetic imprints. We're changing our DNA at the level of the soul. This is how and where this becomes an integrated method of treating developmental trauma. And because we're working at these levels on multiple layers, and we know all is one, one is all, there is no one distinct system from another. They're all interdependent and integrated. Because we're working at this level, it's not a one-shot deal. You're changing the way you live with yourself, your patients, your students, your clients, whatever label the person across from you occupies as they're working in working relationship with you. They are changing the way they live for the rest of their lives. That's what changes the DNA. That's what changes the karmic narrative. So working with these methods, we're looking at, one, the brain, and we're looking at the karmic narrative or the life narrative or the self, the relationship that the person across from you or you, if you're coming here for yourself, has vis-a-vis their trauma. So looking at the image on the left-hand side of your screen, you can see the subtitle is that the brain can get sick too. And what you're seeing are PET scans or positive emission tomography scans. They're signals that the brain sends out that show a healthy brain versus a brain that has experienced repeated messages of trauma. You may have had these things said to you by a parent or family of origin member. And you can see through these PET scans how the structure of the brain, none of us here is an expert in reading PET scans. However, you can see that there's a dramatic change, particularly the ADD, ADHD brain and the OCD brain. The ADHD brain that has experienced trauma actually looks scattered. And I have so many people coming to me these days saying, I have a diagnosis of ADD, ADHD. What does that mean? And the first thing I do is start asking them about their developmental years, because we're looking at how the brain developed in response to an overwhelm of stimulus, an overwhelm of stimuli, and a deficit of stability and attention, clarity, groundedness, procedure. That often, ADD often speaks to a developmental years experiences of living in a chaotic home or a home where the supply and provision of basic needs was unpredictable, or as I often like to say in traumatic environments, predictably unpredictable. You knew it was going to be bad, you just didn't know when it was going to happen. On the right-hand side of the slide, we have a graphic that explains the structure of the personality in the IFS system, or internal family system. At the heart and at the center of the constellation of the human being is the self, the essential self. IFS, or internal family systems, holds forth that there are these disparate, fractured parts of self that have responded to trauma, and particularly conditioned trauma, chronic trauma, complex PTSD, complex post-traumatic stress disorder. There's a fracturing of the original core self that leads to these break-off factions, if you will, the exiles, the managers, the firefighters, each of which has a role in reintegrating the fractured self into a whole self again. And simply put, the role that each of these subsets of the self has when working with them in the therapeutic relationship is to give us, now us is you and me, or us is you and your patient, to give us the information that we need in order to decipher the life narrative and decipher the message that each of these parts is holding about how the traumatic experiences shaped, misshaped, and fractured the original self, and use that information to guide us in the direction of how to change the way we're living, or change the way that the patient is living, in order to walk them out of their associations to trauma and reintegrate into a whole, complete, functioning self. Let's look at the next slide. Now, we start with EMDR, because EMDR works directly with the brain. EMDR works specifically with the limbic system of the brain, which holds our emotional connection to memory. The word limbic is Latin in origin, and it means touching every part. And the limbic system, as you can see, it resides at the center of the brain, so it will contain the pineal gland, for those of you who work with the pineal gland and its role in intuition and channeling of divine energy into the corporeal self. But the limbic system resides at the geographic center of the brain, and it connects to the speech center of the brain, the olfactory center, our sense of smell, the visual cortex in the base of the brain, the frontal lobe for decision-making and cognitive function. And it unifies and it serves as a way station or a transference station or communication center for the various stimuli and signals and communications that are taking place in the brain, both efferently, so the brain sending signals to the body, and afferently, the brain receiving signals through the nervous system from the peripheral nervous system, from the distal parts of the body. Now, the way EMDR works is that we go in, and it's a safe process, so we go into one traumatic memory at a time, because your brain encodes specific networks and specific chemical and emotional cascades based on the memory. So remember, the limbic system connects to all centers of the brain, so there may be a memory that has more visual association. There may be one that has more of an olfactory or a scent trigger. Like, for example, in the case of childhood sexual traumas, if the abuser, if the perpetrator wore a specific cologne or used a specific soap, that memory for that fragrance is enmeshed and encoded into the memory of the brain of the child who was on the receiving end of the abuse. So this is how triggers arise. This is how panic disorders and psychotic breaks can take place. Because amnesia is a common feature of childhood sexual assault, where there's overwhelm. The experience of being violated at such a level overwhelms the limbic system, it overwhelms the mind, it overwhelms the brain, and a dissociation response takes place to the extent that that memory is no longer available to the conscious thinking mind and the conscious thinking self. It can live in the body in the form of digestive disorders, digestive dysregularity, menstrual disorders, dermatological disorders, autoimmune disorders, cognitive disorders, processing disorders. We looked at ADHD just a minute ago. Eating disorders. Eating disorders are one of the most common features of developmental sexual trauma. So if you're working with a patient who has a history of eating disorder, particularly if the patient is a woman, which is not to say that men are not also, have not also suffered childhood sexual assault, but because the overwhelming majority of victims of childhood sexual trauma and incest are girls who then become women. When you're working with a woman who has a history of eating disorder, it's very important for you to at least start to consider that there is a history of childhood sexual assault, and it's perfectly okay with you okay for you within your scope of practice to ask. Of course, we preface these questions with gentleness and respect, clarity, and professional integrity, but we ask because incest is one of the biggest secrets that never gets told or brought into the light and resides in the system as latent diseases that then express themselves later on in life. So going back to EMDR and the limbic system of the brain, EMDR, which stands for eye movement desensitization reprocessing, is an evidence-based, clinically proven psychotherapeutic method for creating a new neural network in the brain. I was just speaking about the olfactory system. Let's say we have, let's just pick a name out of a hat. Emily was the first name that came to me. So let's say we have a patient, Emily, who has a history, and she's told you she has a history of childhood sexual assault. Perhaps she's aware of it. Some people are not. And now she presents to you with insomnia that wakes her up at the same time every night, or she's unable to fall asleep and has a fear of going to bed. As you listen to the narrative, as you do your intake, as you relate to your patient, you'll start to hear the signs and the signals that are woven throughout the narrative. But Emily presents with insomnia. Emily has difficulty getting herself to bed, and she has difficulty staying asleep throughout the night. She wakes up right around the same time every night. Happened to be the same time that her father came in when the rest of the family was asleep to molest her in the middle of the night. Emily may not be aware of the connection, but you as the clinician start to listen investigatively and critically and look for where the outliers exist and look for where the pieces fit together. Where the pieces fit together and where the outliers exist is where you'll start to find the answers to the narrative to help your patient begin to put themselves and put their lives back together. But Emily's not getting to bed easily. She's not staying asleep. And the reason Emily is presented in her office to you is because she had a panic attack and almost lost consciousness at a family wedding this weekend, where her perpetrator walked by wearing the cologne that he used to wear when he abused her. She hadn't smelled it in years. And let's say the perpetrator put the cologne on for the wedding for old time's sake, family event wedding, for old time's sake. Emily's olfactory system, which is connected to the limbic system, has this specific pathway and this specific enmeshment with this cologne and this smell. And once that cologne hit Emily's olfactory nerves, it started following that pathway that's associated with the traumatic memory. Now, Emily, let's say Emily doesn't have any conscious memories. And we're changing Emily's profile and her history as we go along. But let's say Emily doesn't have any conscious memories. And this cologne, this scent, hit her olfactory system. It went straight to the limbic system along this pathway that is encoded for sexual trauma, and her entire system lit up with panic, fear. Perhaps Emily has a flight response or a freeze response. That's one of her 4F responses to trauma. The 4F responses are fight, flight, freeze, fawn. So perhaps if Emily has a flight, freeze combination 4F response, she goes into shock, she dissociates, she loses her sense of space and time, and she starts to lose consciousness. These are how traumatic memories get encoded into the system. What EMDR does, eye movement desensitization reprocessing, is bilaterally stimulate the brain. That's the eye movement part, but eye movement is not frequently used in EMDR. My patients and I have found it to be much more useful and effective to either tap opposite sides of the body or to use a vibratory device. There are vibratory devices and light bars also, if you prefer to follow a bouncing light back and forth. But there are vibratory devices that you hold in your hand that you can control their intensity and their rate of pulsation, and they alternately vibrate. And what they do, and this is how EMDR works, is that it creates bilateral stimulation, alternating stimulation of the brain. So the brain becomes distracted following the bouncing ball, as you then reprogram in, again with tapping, the new association to the old memory. So we don't wipe the memory out. It never goes anywhere because it's already encoded into your brain. Your brain has built a neural network around that memory. What we're doing is giving your brain a preferred option to the old pathway that causes panic attacks, that causes Emily to have difficulty going to sleep at night. And the limbic system, the EMDR, as it works with the limbic system, is completely, perfectly safe. As I said before, clinically proven and evidence-based. There are years of study that show EMDR's efficacy in clinical practice and its level of safety in clinical practice. If you've heard that EMDR is dangerous, EMDR is not safe, I encourage you to investigate further and find out what's happened, because what I see with EMDR in my practice with patients who come to me who have had bad EMDR experiences is that the clinician was either rushing them through the process, because you may have seen this online, do EMDR in a weekend, EMDR in 3 sessions. EMDR takes as long as it takes. Typically, EMDR is given 10 sessions for its successful completion, 10 to 12 sessions. Whether those take place weekly or over the course of, or a couple of times a week, is entirely up to you and your clinician. But really the baseline expectation is 10 sessions, sometimes 12, sometimes more, sometimes less. I find that I have greater success with fewer sessions, certainly not 3, but fewer sessions by combining EMDR with the Eastern philosophical methods. That's the compassion cure. It's developing a level of understanding of oneself through working your and reworking your own traumatic narrative, looking at your own difficulties where you struggle, and applying this method to them. That then gives you the insider perspective on what it is to live a life with a traumatic history, impacting your professional life now, impacting your relationships now, impacting your financial life now. Let's go on to the next part of presentation with the container exercise. This is one of the ways that makes EMDR a safe, I'll keep saying it, a safe and effective method of working with developmental trauma. You and your clinician work together to compartmentalize in a structured clinical way the traumatic memory or a traumatic relationship or just the process of EMDR from one week to the next. I was speaking before, patients who've come to me have had bad EMDR experiences with practitioners who run them through the process or who don't take the time to go back in the process. EMDR has 8 specific steps. And those 8 steps are not always carried out linearly. You may need to backtrack sometimes. There's a step called assessment. And in the assessment phase, we start to look at how your system is responding to the traumatic memory. And if we determine you are good to go, like cleared for takeoff, then we go into the desensitization stage of the process. But if we get to assessment and you're still having panic attacks or you're still getting queasy and nauseous, the somatic symptoms are still presenting themselves, that's the sign to us that you're not yet ready to advance into desensitization, where we actually walk you through the traumatic memory to create the new neural network. One of the things that we do to protect you and to keep you safe, particularly from the IFS perspective, when we're working with exiles, the original earliest parts of you that were eyewitness to the traumas, the parts of you that are still reliving the traumatic memory. Those are the parts of Emily that smelled the cologne and went into a flight response at the wedding. But the container exercise gives your brain, it gives your mind, it gives your body, it gives you, it gives us in the clinical relationship a space where the traumatic memory can be contained. The container exercise is one of my favorites, and it tends to be one of my patients' favorites because it protects them. You get to use your imagination, which is one of the greatest things about EMDR. You get to use your imagination to conceive of a container in which you will put the memory, the person, the feeling of the traumatic memory in your body, whatever you choose. And this is what makes EMDR safe too. You're the one who says yes or no as we go along, particularly when there's a history of developmental trauma, when your environment was completely out of your control and your life was dependent upon, your survival was dependent upon the mercy of the people in charge of taking care of you. When you can control your experience of yourself and control your internal environment, which is what the container exercise does, you start to reestablish not just a sense of safety, but what I focus on much more importantly than a sense of safety is a sense of trust. You as the patient, you as the clinician, start to have a living experience of real enduring trust. And that is why the Compassion Cure is called an enduring method, a method for enduring recovery, something that will continue to live with you once you complete the process. So the container exercise allows you to create a safe space where you can put the uncle. If Emily had a container available to her, she and I, in the clinical experience, would have taken her uncle, the family member, the perpetrator, and locked them away in the container for the duration of the family event. Wedding was the word that I used. With the container exercise, you can take your nervous stomach. Nervous stomachs are frequently, let's go to the next slide. Nervous stomachs are frequently the result of a vagus nerve trigger impacting the solar plexus or the seat of the will, your ability to act with agency, to have an impact on your environment. With developmental traumas, there is so much powerlessness. There is so much having to surrender control in order to just survive, that the third chakra and its partner in the back, the adrenal glands, are frequently exhausted and tapped out and over responsive, or in the case of anorexia, under responsive to stimuli. So having the container, which can look however you want, gives you the option and the opportunity to package this memory, to package the feeling, so you can continue to function from one session to the next. Because remember, we said it takes 10 sessions is the standard, sometimes 8. If we have other methods available to us, sometimes 12. I've been working with someone with EMDR for 6 months now. And it's not a failing of the method. It's not a failing of the patient. It's not a failing of the clinician. It just takes as long as it takes. You're learning how to live with yourself differently. Your patients are learning how to live with themselves differently. You as the clinician are cultivating an environment in which your patients begin to develop the understanding that they are living with themselves differently. It's a lifelong relationship for the rest of their lives. So they're learning how to be their best partner, or what adult children of alcoholics and dysfunctional families calls your inner loving parent. So looking at this, the narcissistic family structure, you may recognize a role that you have occupied in your own family. But as we look at the roles that each of us occupies in our family, we start to develop an understanding of how we function in our relationships now and how we function in our professional environments in particular. We bring our associations, and there's the limbic system again, we bring our associations from our family of origin relationships into our professional relationships. If you work as part of a team and you had siblings, it's guaranteed that on some level, your brain and your mind are constructing and navigating the relationships with your coworkers in the same way that you learned to relate to your siblings, and in the same way that your parents parented you as a group and each of you individually if you were an only child. Different story, of course. However, the way we relate to authority figures is directly reflective of the way we related to our parents and the way our parents related to us. So we look at the role you occupied in your family system to then draw parallels to perhaps how and why you're having difficulty asking for a raise. What's the memory? What's your relationship and your association to having your basic needs met and going beyond having your basic needs met? What's your relationship to success and achievement? What's your relationship to abandonment and failure? And how are these memories residing in the limbic system of your brain and in your physical body that's causing you to make the choices or not make the choices that are producing the life that you're living now? So there are 5 things a child needs to develop a healthy psychology. We also look at these in the Compassion Cure. And this is where we start to find the answers to what happened to you and what to do about it here and now. Children need acknowledgement. Children need to be wanted. They need to feel that they belong and that the system, the family system, welcomes them and nurtures them. Children need to feel safe. They need to know that the nervous system needs to know that it can relax and rest. Perhaps you've heard this with the digestive system, rest and digest, the 2 nervous system states. They're the 4F response: fight, flight, freeze, fawn, which is the adrenaline-driven trauma response, hypervigilance of the sympathetic nervous system. And then there's the rest and digest state of the parasympathetic nervous system, which is able to survey the territory and know and trust that everything is okay, everything is all right. And not only is everything outside the self okay and all right, but everything within the self is okay and all right. And children begin to accept themselves. Children also need encouragement to take healthy risks and to have a healthy relationship to achievement and success. So if you're someone who experienced financial trauma, abandonment trauma, and you're having difficulty earning to your potential in your life now, and you cannot figure out why, you've taken all the courses, you've done all the things, you've read the books, you're doing the affirmations, you're showing up, you're doing your best job at work, and somehow the money is not matching your effort or your capability. We look at what your relationship to achievement and success was when you were growing up. We look at what encouragement looked like for you. Was there any encouragement at all? Was there acknowledgement? Were you acknowledged as a unique and valued and loved and desired entity just the way you were? Or did you grow up in an environment of never good enough isms, or never good enoughness? Did you have high aptitude and always score well on exams and come home to hear what happened to the other 2 points? Was there any extra credit? If you got the extra credit, was that all the extra credit you could have gotten? That's never good enoughness as it relates to achievement. That then breeds a level of perfectionism and vigilance in the nervous system that makes it impossible to, one, feel satisfied with yourself and your accomplishments, and continue to strive and advance yourself in a way that's commensurate with your natural gifts and talents, because you're always running into a roadblock, and the nervous system is always being encoded for this roadblock of no matter what you do, it'll never be good enough. And some people go in the direction of workaholism, some people go in the direction of underworking or under-earning. Oftentimes there's a flopping back and forth. But these are the things that we look at in your developmental years when your adult life is telling a picture of possible, likely financial or emotional abandonment traumas in your history. I just skipped a slide. I didn't mean to skip a slide. And there's no way to go back, so we're just going to keep going forward. The slide that just flashed by was one of the internal family systems models, and I'll just speak to it here. Internal family systems, as I mentioned at the beginning of this presentation, looks at the core selves. You remember that graphic that we had? That was the wheel with the 4 swirly segments in it. Your essential self, the original you that you were born as, remains at the center of your being. That's the part of you that's immutable. That's what makes internal family systems, as its creator Richard Schwartz says, a spiritual system of recovery from developmental trauma, because we're looking at the original you, the immutable you, the eternal you, that you recognize in passing moments, perhaps, or perhaps you have a practice that allows you to touch in to your essential self. It allows you to recognize, to see, experience, and recognize and celebrate and cultivate your original self. That gives you a sense of who you actually are, reminds you of who you actually are. For me, there are numerous things like that. With the one closest to my heart is my ballet practice. I lived a life as a professional dancer when I was younger, and ballet remains the practice at the center of my heart. Standing in front of the mirror and in a ballet class is when I remember exactly who I am, and I know exactly who I am without question. This is where practices, physical practices, or any practice that brings you in touch with yourself. For some people, it's painting. For some, it's cooking. For some, it's physical exertion. For others, it's spending time in nature. For some, it's silence. For some, it's the creative process, music, crafting, building something, making something, relationships. It doesn't matter what it is. What matters is that it is, and that you're willing to give it to yourself on a regular enough basis so that your relationship with yourself, with the self, becomes the dominant tone of your nervous system, rather than the expressions of the exiles, the managers, the firefighters. These are the 3 subsystems of internal family systems that we work with and we look at in the Compassion Cure and in my class on working with internal family systems in the clinical relationship to treat developmental traumas and addictions. Now, with the with the IFS system, not only is it a spiritual therapy, it's a somatic therapy because we look for the places in your body where the messages and the information was a word I used at the beginning of this presentation, where the information is residing in your body as a traumatic memory. The digestive disorder, the queasiness in your stomach, the tightness in your back, the knee injury from gymnastics in high school, the ankle sprain that never got properly healed, the migraines, menstrual irregularity, erectile dysfunction. We look for where these exiles, managers, and firefighters are living in your body, are living in your life, and we start to ask them for what they need. You start to become more conversant, or if you're the clinician, you teach your patients how to become more conversant with these disparate parts of self. And we start at the end of the list, actually. We start with the sensations, which then lead us to the feelings. So there's a physical expression. I'm nauseated, or my back hurts. And we ask the question, which is part of the inner child work, what do you need? What do you need? What do you need from me? Because whenever we're working with developmental traumas, particularly when we're working with addiction, addiction is so much about the developmental trauma, and it's not about the addictive presentation. There's a saying in recovery circles, if you work with patients or you have any familiarity with 12-step recovery, there's a saying in recovery circles, it's about the alcohol, but it's not about the alcohol. It's about the drugs, but it's not about the drugs. It's about the compulsive gambling or spending or compulsive sexual conduct, but it's not about any of those things. It is about this middle word here, needs. It's about unmet needs, deep unmet needs from the developmental years, the abandonment of which was so profound that it produced a fracturing of the self. An exile broke off. And the exiles are the ones that are holding the information for where the deepest needs are. And once we start to recognize what we need, we start to find the feeling associated with it. I feel sad. I feel devastated. I'm furious. I'm happy. I'm happy. Being able to say, and these are things I've heard in treatment, being able to say, I'm so happy he's dead. I'm so happy he's gone. It's such a relief to me. I feel relieved that he's dead and he's gone because I never have to worry about him coming into my room again at the end of the night or showing up in my life unannounced and uninvited after I've established a no contact boundary with him. You'll hear any and everything in clinical practice, and this is how the Compassion Cure works as well. It gives you, if you're the clinician watching this, it gives you the opportunity to develop listening skills and to develop a level of stamina, psychological, mental, emotional, spiritual, physical stamina that makes it possible for you to be in the room in the face of some of the most unspeakable horrors and unfathomable horrors that you will likely ever hear in your life, and remain present and compassionate in your own body because you have gone to these depths with yourself first. The Compassion Cure, the course of the Compassion Cure, is offered in such a way that you have the opportunity with every class to rework your own traumatic narrative and to touch into the depths of your own authentic, original core self. So you can then, from the insider's perspective, make suggestions and listen critically, listen clinically, listen compassionately to your patients and guide them through the process of restoring themselves back to themselves. And speaking of feelings, the feelings wheel is one of the things that I use in clinical practice, because oftentimes we're working, particularly with exiles, you're working with the pre and nonverbal parts of yourself, the oldest parts that were the eyewitnesses to traumatic memory. And because they're pre and nonverbal, they don't have the capacity for language. Like, think of how well can a 2-year-old express the horrors of witnessing daddy assaulting mommy. A 2-year-old has no capacity to express what that feels like inside of them. And that's why we go for sensations first, because through the visual cortex, through the visual witnessing of a trauma or the visual experiencing of a trauma, the kinesthetic, the physically lived experience of experiencing a trauma, the body has a physical response, and the limbic system, in creating its emotional connection to that memory, creates a specific pathway that is associated with that physical response and that memory. But to ask a 2-year-old to tell me what happened, use your words. I can't help you if you don't tell me what happened. These are things we probably had said to us, and it's possible that we've overheard a parent saying that to a young child. If the child does not yet have developed the capacity for articulating, the brain has not encoded itself for language that at that advanced a level to say, this is how I feel, there's nothing but sensation. There's nothing but sensation. Children don't understand, I'm going to pick a word from the wheel, resentful. 2-year-old doesn't understand what resentful means. A 2-year-old doesn't understand what annoyed means. 2-year-olds understand happy. They understand the lighter end of the spectrum. They understand scared. But even then, scared is not terrified. And children and the part of the brain that's encoded for traumatic memory that may be 2 years old, it may be 6 months old, it may be pre-birth old. If the mother carrying you experienced chronic traumas when you were developing, your nervous system may be encoded for memory that's transgenerational, that dates back 2, 3, 4, 5, 6, 10 generations. Looking, for instance, at the culture of slavery, looking, for instance, at Auschwitz and Nazi concentration camps. Looking, for instance, in this day and age, in 2024, this is being recorded, looking at what's taking place in Gaza and the Ukraine, what's taken place in Vietnam, where there have been chronic traumas that imprint on women who are carrying babies, which then genetically imprint into the developing fetus. And the child now carries the chemical signature of trauma. There isn't even a brain developed in certain stages, in the earliest stages of gestation, yet the feeling, the chemical signature associated with the feeling is encoded into the nervous system. And this is why we use somatic therapies in this work. The somatic therapies work with the messages, information that the body is communicating through signs and signals and or times full-blown disorders to understand what the deep unmet need is and what the feeling associated to that unmet need is on both ends of the spectrum, because we want to understand the depth of sadness, but we also want to understand where the height of joy resides for the person in question, even if they can't get to it to themselves. And this is where the Eastern philosophical principles become indispensable in my work and my practice. Buddhism, the practice of Buddhism, holds forth that we live in a interdependent dimension, an interdependent universe. There's something in Buddhism called the law of dependent origination, meaning that in order for any one thing to exist, its opposite must also exist. Like light and cold, light and dark. We don't know what light is unless there's darkness. We don't know what hot is unless there's cold. It's contrasting phenomena that are relative to one another that give us perspective on what the experience is. Einstein explained it in his theory of relativity. It's a relative universe. Things are dependent upon one another, particularly their opposites or the contrast, in order for us to have a sense of placement for where we are on the continuum of space-time. So these are some of the levels on which we speak in the compassion for. These are the levels on which I speak in all of my teaching, because this is the level on which I operate. We work, yes, with the body, but we're also working with the karmic narrative and the metaphysical experience of the core self. Now, the workshops that I teach are 2 hours long, and in each of these 2-hour workshops, you go through the history and the theory of the method, and you can read all of this for yourself. There are group exercises and breakout rooms that give you an opportunity to workshop these skills and techniques in real time with other people who are meeting you on your level where you are. That's the essence of how the Compassion Cure works. You go to your own depth with yourself. You learn this theory, you learn the methods, you work them with other clinicians, other practitioners, other patients, and you have the experience of being on the receiving end of compassion and love and deep attention for your developmental traumas. You receive the mind medicine of the Eastern philosophical principles, along with the mind medicine of techniques and skills and methods from the Eastern philosophical teachings, in combination with EMDR, internal family systems therapy, to develop a lived experience of feeling the parts of you that were lost to developmental trauma, and rescuing those parts and reworking those parts and integrating them into a whole self. And then you have the skill and the ability to do this for your patients or your students, with your family members, with your loved ones in your life. You become a better you. And when one element in the system changes, the whole system changes. So when you become a better you, any and everything that you touch becomes an expression of your better self. So these are old, I'll stop the screen share now. These are old dates for old workshops. But thank you so much for watching this presentation. Thank you for being here. You can find out more about the classes that I teach on ThisIsDrM.com, my website, where you'll also find past lectures. You'll find this video. You can find it on the YouTube channel. I am here to be of service to you in your own awakening as a clinician, as a practitioner, as a patient seeking to recover from developmental trauma and or addictions or processing disorders and process addictions. And I'm here to make your life a better experience of itself, to give you the opportunity to have a fuller, richer, more clearly realized experience of being yourself in the world. Thanks again so much. Please share this video with others. Follow me on TikTok and YouTube. Like and subscribe on YouTube. And follow me on Instagram. You can find me on LinkedIn if you're looking to book a speaker or an in-service clinician for your school, for your program, for your company. You can reach me on all the social media platforms, and you can also email me at ThisIsDrM@gmail.com. Doctor is just DR, no period. So ThisIsDrM@gmail.com. And you can find ThisIsDrM, Dr. M for magnificent, on all the social media platforms. It's a pleasure having been here with you, and I look forward to seeing you live in a workshop. Thank you so much. Bye.